Hello and welcome back to PI Today's podcast. We are on a roll here in sunny Oakland. We have another special guest for you guys, Dr. Kemesha Delisser. So, Doc, welcome on the show.
Hi, nice to be here.
So tell us about your profession, tell us about your training, tell us everything.
Well, even though I'm in the Bay Area, I'm a New Yorker at heart. I trained in physical medicine and rehabilitation in New York City and did my fellowship in interventional spine and pain management at Stanford in the Bay. And that's what got me here and eventually led me back. I practice mostly across several offices in Northern California, seeing people who have been afflicted with musculoskeletal injuries, spine, different joint injuries, as well as traumatic brain injuries from work injuries and other personal injuries.
Got it. So Stanford, huh?
Yeah.
What a treat for me. Finally, I get the double hitter. I get beauty and brains. I only usually just get brains, so it's a special day for me. Doc, so PM&R, you do your pain management also.
Yes.
So you do the regular, epidural, lumbar, cervical types of epidurals and facets.
Yes. From head to toe. So, epidural injections, facet injections, radiofrequency denervations for not only the cervical, thoracic, and lumbar spine, but I also do it for joints as needed. So shoulders, hips,
Oh wow.
knees.
Oh wow. I haven't heard that one before. That's great. Do you do any type of implants or trials?
Spinal cord stimulator trials.
You do the trials, okay? You do the
Right.
spinal cord trials, sure, okay. And then you refer out for the implants,
Yes.
okay, which is very normal. Okay, so we were talking about earlier off camera about traumatic brain injury, which most people don't know that PM&R of physiatry is the lead doctor when it comes to rehab and evaluation of a traumatic brain injury patient. So tell us about some of that training in traumatic brain injury that you have and catch us up.
Well, physical medicine and rehabilitation as a field actually came out of war times, and it includes lots of very traumatic injuries: spinal cord injury, traumatic brain injury, amputations, in addition to usual musculoskeletal injuries. So my formal training in physical medicine and rehabilitation actually included all of that. In addition to management of traumatic brain injury, everywhere from mild concussion on a high school football field to hanging out with my program director at the Golden Gloves,
Oh
because he
wow.
was a doc for that.
Oh wow, yeah, that's a lot of traumatic brain injury, which is needed. Now, this is what we lack in our field is PM&R that does TBIs. Usually when people they get to choose, they either do pain management, which is the injections and the stuff that anesthesia or neurology might do and just choose to do that. But it's really great that if we have a physician that's a PM&R that would see traumatic brain injuries because it's really up their alley. And we're very happy that you do so. So, what about any alternatives like PRP? Do you do stem cells? Do you do any type of regenerative or like doing them, don't like doing them?
Oh, I enjoy orthobiologics. Our field is all about regaining function. And while our injections are helpful, I have seen great gains in return to function with orthobiologics. So PRP, stem cells, I do that in any place that I can place a needle. So epidural for annular tears,
Oh, wow.
PRP in the disc,
That's right.
right?
That's wonderful.
And also all joints,
Yes.
right? Anywhere there is a tear that isn't so far apart that it needs to be surgically put together, I think it's worth trying to get your body to heal as naturally as possible.
Amen to that. I haven't heard that one in a long time. Good for you, Doc. So thank you again for joining us, and thank you for servicing the field, and hopefully we'll have you back on a later time.
That'd be great.
Take care, Doc. Thank you so much. Bye-bye.
Thanks for listening, PI Today podcast, sponsored by Trauma Cash, Global Lean Doctors and TBI Analytics. You can find us on our website, www.pi2daypodcast.com, also on Instagram, YouTube, Spotify, TikTok, and LinkedIn as PI 2-Day Podcast to watch all our episodes. See you next time.